Jim Jordan comes on to speak with Ali Velshi, and Ali Velshi had him for dinner talking about Obamacare and how bad Obamacare is and all the bad things that it has done to the insurance market. And Velshi reminded him, there is no country in the world where the free markets work in the healthcare industry. And we know it's absolute, it's not rocket science to understand why. I want you to take a look at this, and then we'll take it on the other side.
We know Obamacare's a mess. Fewer choices, higher premiums, higher deductibles. It's a complete disaster.
Right.
So
I have to stop you there, sir. I have to stop you there because I hear this talking point all the time. Under Obamacare, the premium increase has been lower. I heard you guys at your press conference yesterday sort of mincing words with that one. We do have to acknowledge that. There were higher premiums before Obamacare. There are higher premiums during Obamacare, but the rate of increase has been slower.
Ali, no one's arguing that healthcare was wonderful before, but what we've forgotten in America is what a healthcare market looks like. So think about what Obamacare did. More mandates, more taxes, more regulation, drive up the cost of insurance, mandate people buy it, and if they don't, they get penalized. What kind of deal is that? Okay. Let's actually bring back affordable insurance for working class families.
There was never affordable insurance. And I was just saying to Bill Kristol, nowhere on the face of the earth is there a free health insurance market that works. If you could point me to one and say that a free market works. It's just one of those areas that a free market doesn't work.
It will work much better than it's working now under complete government control of healthcare, for goodness sake. Do you think people are satisfied now? How about people in the individual market who went from paying, single people individual market went from paying $100, $200 a month to paying $500, $600 a month for a $6,000 deductible policy?
You know, sir, that in all those countries, all the developed countries that have single payer systems or universal health care, happiness about health care is actually substantially greater than it is in the United States.
Then why do they all come here? Why do they all come here for treatment?
They don't all come here. Republicans say that all the time. They don't all come here. They don't all come here. People in Canada, people in Norway, people in the United Kingdom, people in Sweden, people in Denmark, they don't all come to the United States for healthcare. Why do you say that?
Well, because you see it all the time. People in Canada come here for extensive surgery. They come here and get it done in the United States.
Sir, I grew up in Canada. I live in Canada. My entire family's in Canada. Nobody I know ever came to the United States for healthcare. I'm sure you have a handful of stories about things like that. It's not actually statistically true.
How is it ever going to be possible for there to be a free market in healthcare when there isn't free choice? And what do I mean by free choice? When you get sick, you don't get choices. You have to go as quickly as possible to get the solution to your illness to prevent you from dying. That means there is not an equal partnership there where free markets can work. It is clear. It is impossible for free markets to work in healthcare and in industries where the goods that's being sold is critical for your existence, it's critical for your survival, it's critical for your financial well-being, etc. Those are the industries that belong outside of the free market system. It belongs in the commons because it is the commonality among us. It is society that can actually get those problems solved. It is society that can actually create the wherewithal for solutions. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.